Hi, good afternoon, everyone. Thank you for being here today. We are pleased to have today's seminar, and Ester Marco is our speaker. And I am Keisha Pollack, and I'm the director of the Institute for Health and Social Policy. And part of the reason why we're using technology is that we also have a center at the University of Pampa Fabra in Barcelona, Spain. So we have colleagues who are watching remotely, and we're trying to really build collaborations between our institution and UPF. And Ester is here from, I think Maurice just took my bio that I had of you. He picked it up. Unfortunately, so I had a bio which Maurice just took, unfortunately. So anyway, that's in the spirit of technology challenges. Now I will turn it to Ester to introduce herself. But basically, Ester has been with us for 6 months as a visiting scientist on faculty with the Institute for Health and Social Policy. And she's been doing a lot of work with Dean Josh Sharfstein, which she'll tell us about a bit today. But she is a lawyer by training, and also has her doctorate in law, and she is in the Department of Law at Pampa Fabra University in Barcelona. So I'm just going to turn it over to Ester to share anything else you'd like to before you give your seminar.
I want to thank you, first of all, the department for hosting me.
Are you on?
Yes,
Okay.
for 6 months. It has been a really nice pleasure being here and trying to research that sometimes in your own institution you don't have time for your own research. And I would like to thank you, Professor Bullock, Professor Sharfstein, and Professor Navarro for supporting my research and for organizing this seminar today. So regarding this seminar, during the next 40 minutes, I'm going to try to answer the next question. I'm going to try to answer how the European regulations on budgetary discipline, in particular the European system of accounts, is determining the way that health services are provided in the EU member states. This question, I think it's important because European institutions don't have power in terms of regarding the field of provision of health services. So they are exercising this kind of influence or this power through other competences. The European institutions have competences in budgetary discipline and economic governance. But this kind of influence, it goes beyond just to establish obligations of performing systematic budgetary cuts. It's not a question about just achieving the numbers, the 3% and the 60%, the 3% of the deficit and the 60% of the debt. It's a question of, in a way, determine how the health services should deliver in our countries. So, to do so, I'm going to structure my presentation in 3 parts, but I'm going to focus on this part, the third part. So I'm going to talk a little bit about the European budgetary discipline and how the European system of accounts works, and especially the role of Eurostat. Eurostat is controlling actually the budgetary discipline in Europe. It's the European Commission. It's the statistical office of the European Commission. And then I'm going to focus on the 2 mechanisms that member states have been performing in order to reduce the impact that health services have in the levels of public deficit and public debt. The first approach has been like performing PPP projects, and the second approach is not as well known as the first one, but it's really important. It's not a minor approach. It's like the creation of public corporations outside of the general government sector. And finally, I'm just going to end up with some conclusions, and I want to hear your thoughts and your ideas, definitely. If any time you want to interrupt me, please feel free. So the budgetary discipline in Europe is based in this article, in Article 126 of the Treaty on the Functioning of the European Union. The article established, first of all, a general mandate for all the member states that member states shouldn't have excessive deficits. And then after the general mandate, it sets forth 2 criteria, the deficit criterion and the debt criterion. So if we can see that it's just like numerical controls. It's not like just numerical. So to the extent that the member states shouldn't surpass this 3% and the 60% of the GDP, regarding to the GDP. The 3% and the 60% have been unchanged for 20 years now, since the Treaty of Maastricht. And in legally talking, because I'm a lawyer, it's pretty easy to change them. So they didn't want to change them. They are not established in the wording of the treaty. They are established in another protocol. That is, to amend the protocol, you just have to do it within the European institution. So they want to keep the levels stable. So all these mandates have been developed through the Stability and Growth Pact. The Stability and Growth Pact contains 8 pieces of legislation, and all of this legislation, the only goal is to ensure that member states have solid public finances. So this is the goal. We don't have to forget the goal, because we're going to see how it works, and then we have to come back to the main purpose of all of this Stability and Growth Pact. So in order to fulfill these requirements, the 3% and the 60%, we had to have concepts that they had to be autonomous, because we are different member states. So we have our own concept of deficit, and our own concept of debt, and our own concept, legal concept of general government sector. But we cannot apply our concepts. We had to apply the European System of Accounts concepts in order to all of them to be applying the same restrictions. So they had to be autonomous, and because they had to be measured, they had to be precise. So that's why we define them through this methodology. So the European System of Accounts is accounting, it's national accounting to determine the concepts. But in practice, this is the theory, but in practice, the application is not straightforward, because in order to determine the scope of the concepts, you have to measure the risk that the government is assuming in each operation. So you want to control the stability in the long run, so you don't measure the liabilities now. You measure the liabilities also in the future.
Excuse me, Esther, I'm wondering about the 3% and 60%, if there was a consensus at the point of when these numbers, I'm assuming no, in terms of when they were identified, and sort of what you know in terms of the history of what the debate was in terms of what those numbers should be.
Yeah, it was Germany mostly who wanted to establish the 3% and the 60%, and we have another treaty, the Fiscal Compact, after the crisis, after the financial crisis and the economic crisis. We have another treaty with like more restrictions, but these 2 levels have been stable, because even Germany during 2002, 2003 didn't fulfill these requirements. So everybody's a little bit worried. Yeah, maybe nowadays I'm doing perfectly, financially talking, but maybe tomorrow not. So we're going to keep it. But we're going to see that, okay, you don't change the number, but if you change the concept, you are changing that directly the numbers. So in order to determine so we had to measure the risk. So if we measure the risk, we can distinguish like 3 zones. Like it would be like government sector, like made up of entities and liabilities that are always going to be public debt or deficit or general government. But we have, like, in terms of risk, a gray zone. A gray zone made of entities and liabilities that eventually could be classified here, but they are classified here, depending on the risk. So, for instance, with one example, if the government has to build a road, it has 2 options. The first option is issuing general government bonds in the capital markets, obtaining the financing, and then paying for the road directly to the private sector with a turnkey contract. But the second option is subscribing a long-term contract with the private sector, paying a shadow tool for 30 years, and then you have the same result. But the difference is, the first option, always the liabilities are going to be classified inside of the general government sector, but the second option sometimes is going to be classified outside. So you have the same asset, you have the same infrastructure, but you don't have the impact on your debt. So finally, we have the third zone, that private sector, that in principle is made up of liabilities or entities that are not going to affect the government sector. I say in principle because we used to classify the bank sector there, and then suddenly impact in the government sector. So what about the European System of Accounts and the role of Eurostat? So in order to measure all this risk, we have to the European System of Accounts established this kind of test that we're going to call them tests. So Eurostat, because Eurostat, the statistical agency of the European Union, is controlling a lot of entities and a lot of operations, but it's doing it together with the member states in this process of cooperation to determine the levels of public deficit and public debt. This is a complex situation because you are working together with Eurostat, so it's cooperation. So these decisions, Eurostat decisions, they don't have binding nature. So you cannot contest them before the European Court of Justice. So the states are located in the worst position because it seems like you are cooperating with Eurostat, but you have to follow their advices because they are always advices. But if you don't follow them, they're going to change the data and your financial credibility is going to be affected. So this is the complex situation between Eurostat and the member states in this cooperation. So the results of the test are going to determine the scope of the concepts, and the member states have to follow the advices. We're going to see some of the advices. And under these circumstances, in my opinion, it should be desirable that the European Court of Justice define these concepts in order to apply them equally to all the member states, because sometimes they are not being applied exactly the same to Germany and Greece. So we're going to see it. So after following the approval of the European System of Accounts in 2010, that was approved in 2013, before we had the European System of Accounts 95 for at least 20 years. So after the approval of the European System of Accounts 2010, the European institutions are reducing to the minimum the gray zone. They don't want the gray zone to exist, but they are doing it, expanding the government sector. So the consequences are clear. First of all, you have higher levels of public deficit and public debt, even if you are performing exactly the same. And the margin of maneuver for the member states is smaller. And second, they don't want the public corporations. Then public corporations that are performing perfectly financially, that they were located in the gray zone, and they have this more flexibility to operate in the market, they are being reclassified in the general government sector. So all the constraints and all the controls, like pure and simple administration, they're going to be applied to them too. So maybe they're going to lose this successful management that they were performing, because some of them, they are doing fine financially talking, but they're going to be classified here. So let's move on to see how are the member states creating these entities and these operations in the gray zone. They used to do it a lot. So the first option is creating a PPP contract. I'm going to focus on the contracts. The PPP concept, we have like the classic classification divides in the pure contract and also the institutional PPP, but we're going to focus on the purely contract PPPs. So the purely contract PPPs, is the European System of Accounts define them as long-term contracts between the public and the private sector to provide an asset or to provide an infrastructure, and then they're going to be for a long term, at least 10, 30 years, and the government is going to pay mostly for the infrastructure. So if it's the user, if it's the private sector contracting directly with the user, it's not a PPP, it's going to be a concession. So for us, it's for us, because in Spain, normally the PPPs in legal terms are concessions. But the important fact is like the government is paying mostly for the cost of the operation, or the transaction, sorry. And this payment is going to cover the operating costs and also the capital expenditure. So why are they so attractive in terms of budgetary discipline? They are really attractive because you can fragmentate the cost of the asset during the 30 years, during the duration of the contract. Because each year, in terms of a European System of Accounts, in terms of deficit, in terms of debt, the government is going to record the payment. that the payment is covering the operating cost and part of the capital expenditure. So, but to achieve this goal, to have this PPP outside of the general government sector, the private sector has to be bearing most of the risk. So Eurostat considers that, okay, if the private sector is bearing most of the risk, then it's the economic owner, and the operation is going to be in the gray zone. But on the contrary, if the public sector is assuming most of the risk, then all the capital expenditure is going to be recorded from the first year, exactly like a normal procurement contract, from the first year in the government accounts. So you lose the benefit, you lose the advantage. So obviously, what's going to happen? And if it's an allocation of risk, you're going to try to transfer all the risk to the private sector, or at least it's going to seem that you are transferring the risk. But we have a lot of difficulties with risk. Risk is really hard to assess because in the beginning, Eurostat determined the existence of 3 types of risk, like construction risk, availability risk, and demand risk. But then suddenly afterwards, other risks appear, like the expropriation risk. We have really hard problems with the roads in Madrid because suddenly the expropriation risk appeared, the obsolescence risk, the residual value risk. So it's not easy to classify the risk. Then normally we're facing large projects. It's what the International Maritime Fund call them like projects too big to fail. So the governments are going to bail out the project. So the government is always facing the ultimate risk. And finally, you are assessing risk now. You are assessing risk in the wording of a contract, but you have to take into account that that contract is going to be on for like 30 years. So the situations probably are going to change a lot. So this, together with the difficulties of like detecting the risk, we had the difficulties with the allocation of the risk. So Eurostat in the beginning in 2004 was really flexible. Okay, if you transfer to the government sector the construction risk and one of the other 2 risks, then the private sector is going to be the economic owner. But now, with the gray zone and trying to reduce the gray zone, you have to transfer most of the risk to the private sector. Otherwise, it's going to be considered public.
Excuse me, Esther, can you give us an example of another large project that's considered by the government as too big to fail? I mean, you mentioned roads, but I mean, can you just give us a sense of?
But normally it's roads, hospitals in Valencia. The Alzira model one was a total failure. So normally roads. Other ones are more stable, like
more like infrastructure types of
infrastructure and health. Health's been also. So in terms of health, some of the previous problems that I mentioned are being accentuated because of the nature of the health system and because of the nature of the health services. So the main risks, some of the most important risks, are those that rise with technical obsolescence, aspects like technical obsolescence, changing regulation, or not meeting patients' needs. And this kind of risk, they are going to be always, they're going to lie on the government sector. This is, if we had to assess in general the results from the PPP in Europe in terms of health, we could say that the results are mixed because the projects are so different, and we cannot say, okay, all the PPPs were successful. No, we can like mixed results. But in general, if we assess, if we look at the PFI, for instance, in UK, the private finance initiatives, they have been really unsuccessful. The House of Commons in 2012 published a report about the PFI in UK, the first PFI, the first model, and the costs were higher, the services weren't better, the private sector wasn't more efficient. So they are trying to converse and they are trying to create this PFI too, but it's always the same problem. We had the problem with the transfer of risk. And we have problems when we are trying to assess the results from the PPPs. We have problems like just finding information because it's really hard. Sometimes we don't even have information about how is the public sector performing, so you cannot compare. And sometimes you have like contradictory information. The Algeria model is like a key example of contradictory information. Sometimes you read that it has been really successful. Sometimes you read that, oh no, it has been a great failure. So now the autonomous community of Valencia is going to recover the project and it's going to be public. So what is then if we have this problem and it's difficult to solve, how is the other way to do it? How is the German, we can call it the German way. So Germany is creating public corporations with market production. This is possible because Eurostat also, again, with a flexible interpretation, allows to have like a corporation that is public controlled and mostly financed by the government sector, but classified in that gray zone. It was really flexible with these circumstances, with this option. But then nowadays it's trying to restrict this option again. But what happened? If you create this entity outside of the general government sector, you're gonna transfer, like you're gonna pay for like the operating costs, and that transfer is going to increase your deficit. But when you pay for the capital expenditure, like to invest, you can be investing. So once you invest, your deficit is not increasing because you are investing. So it's not going to be recorded. It's going to be recorded in the government accounts, but in the sides of the financial accounts. So it's not going to impact. It's not going to increase your deficit and your debt. So this is a really good option too. How do you do it? How is the way? So this is the test. In order to determine if an entity is inside of the general government sector, first of all, we have to analyze if it's an institutional unit. Second, we have to analyze the nature of the unit. And then finally, if it's public or private. And then finally, we have to determine if it's a market producer. So you can have a corporate outside of the general government sector, public and mostly financed by the general government sector, because the key element is all the payments from the government to that entity can be considered sales. This is the key element. Otherwise, you're not going to be a market producer because the government is paying most of your costs. So if we analyze the three criteria, if we look at them, the first and the second criteria refer to the control of the entity. Like the first is the control of the normal functions, the daily function of the entity, and the second is the control of the general policy of the entity. So it's not that sometimes we have like the last survey that I saw from Eurostat is from 2009. You cannot have access directly to this kind of surveys. They have to do it through the statistical national authorities. So some of the hospitals in Spain don't have like institutional unit condition. So if you don't have institutional unit condition because the government is controlling your functions, your daily functions, then you're going to be straight classified inside of the general government sector. So we don't have to carry on with the analyze. So this is the best option. If you don't have, if that entity is not an institutional unit, it's really easy to classify the entity. But if the entity has institutional unit condition, then you have to analyze the nature. So the nature is who is controlling the general policy. Eurostat, again, is tightening this criteria really hard. So before it was just 3 indicators. Before, Eurostat used to just check who was controlling the government bodies of the entity and who was the ownership of most of the voting interests. But now it's also looking at some other indicators regarding the financing. So if the government is contracting all the time, mostly with that entity, then Eurostat is going to consider that it's controlling the entity via contractual agreements. So this is the result. The result in Spain is like some non-profit institutions, private, like Johns Hopkins, are being reclassified inside of the general government sector. Because the Ministry of Finance understands that CatSalut, the health department from Catalonia, is controlling them through the contractual agreements. So we're going to have, if we have a flexible interpretation of this concept, we're going to have an incredible public sector, even private companies. So, and the second option is, the third criterion is the market criterion. This is the key element here. So the market criterion has been also is nowadays really strict. How have they done it? They have separated the criteria into the qualitative criterion, and the quantitative criterion. During the European System of Accounts 95, just the quantitative criterion exists. So they established another part. So the quantitative criterion, the public entity should cover at least 50% of its costs by sales. So, but the government transfer can be considered sales. So the key element now is like you have to pass the first part of the test. You have to have this market situation. How to assess the existence of this market situation? There is important difference. Eurostat established a general criteria about the qualitative criterion, but then establishes a special test for public hospitals. So establishes this decision tree. It has Eurostat establishes this test. Wow. Okay, perfect. So Eurostat establishes this test just for the hospitals, the public hospitals. Why? Because some of the public hospitals in Europe are classified outside.
Increase your slides again.
So if we look at the decision tree, we're going to see like the first question is, has the public hospital autonomy of decision? This is the normal question, the first criterion. So we have analyzed it, yeah. And the final question is the 50% rule. So we had to pass the second and the third question. This is the qualitative criterion, these two. So these two, to sum up, is this. The second question is, to have this market production, you have to be competing with the private sector. So you have to be competing. The European System of Accounts manual, we have Eurostat published also a manual because the European System of Accounts is so complex that they publish a manual to have you to interpret the European System of Accounts. So it was like most of the activities of public hospitals, they have to compete in most of the activities. But then a few weeks ago, suddenly Eurostat published a decision regarding the classification of one hospital in Greece. And then it's like, not just you have to have competition, not in cardiosurgery in general, because this concrete hospital is just performing heart transplants, and there is no other private hospitals performing heart transplants. The hospital is going to be reclassified inside the general government sector. This is a non-profit that Onassis create. So they're going to reclassify it because there is no competition in heart transplants. This is really unbelievable because competition in heart transplants, this is my first concern. Why we should have competitions in all the fields? Even in US, then I look at the US stats. I was here, so I look at the US and I look at the US experience and I see the affordable care organizations. Even the Federal Antitrust Agency are allowing the affordable care organizations that reduce the competition. But if that situation is going to increase the quality of care, is going to reduce costs, or is going to bring innovation. So why competition always? Competition, if it's going to bring this outputs, yes. Otherwise, why a hospital that is competing with other hospitals but is more sustainable in the long run? You had to, okay, we carry on. So, okay, we're gonna see, okay, we're gonna accept, we have to have competition in all the fields. let's check how is the mix between private and public in all the fields. So in Europe it's going to be hard because most of the hospitals are public. So, and then there is a few exceptions. Belgium a little bit with a lot of nonprofits, then Germany with some nonprofits, and then the Netherlands. The Netherlands is like 100% nonprofits. So the Netherlands, like all of the hospitals, they don't have public hospitals. They have nonprofit private in hospitals. So, okay, we will think, okay, just Netherlands is going to achieve and is going to pass the test. But no, because if you remember the criterion of control, they're going to consider that in a way they are controlling the non-profits because they are contracting mostly with the public sector. So again, they're going to be reclassified and they're going to be considered public because they don't fulfill the first criterion, the control. So what is the only way to do it is to break the monopsony. They force you in a way to break the single buyer. Just as you have a lot of buyers, then a lot of buyers are going to be buying to the provider, and it's not going to be controlled via contractual agreements. So Netherlands is, we all know that Netherlands and Germany are introducing managed competition. So they have private insurance now buying, but when you study the system, you realize that they are not really competing. Because for instance, all the private, the 3-4 private major insurance, they are contract with the 95% of the providers. So why are they contract with all the providers? It's exactly the same. Because normally, like in Europe, we had these problems with the credibility commitment problem. So consumers, patients in Europe, we don't believe that if an insurance has a narrow network of providers, it's going to look for us, it's going to look for our care. Or also the private insurance in Netherlands, they have problem assessing the quality of the providers because it's new for them. So real competition is still work in process in the Netherlands or in Germany. So finally, after like breaking the monopsony and having competition in all the fields, so let the private sector to operate in all the fields. So finally, you have to pass the third question. And the third question, and obviously I forgot, why to break the monopsony? This is another question, it's another concern, because like the public option here, the expansion of the Medicare, so the single buyer is like less cost, administrative cost. So we know that multiple buyers higher the prices. So why to break the monopsony that it's actually working in terms of market, health system? Maybe in other market, no, but you don't have to apply the market criteria to this market that has so many failures. So the payment system. Regarding to the payment system, the payment system has to be equal for private and public hospitals. This is all right. I don't have any concern, but the payment system must be directly linked to activity. Wow, linked to activity or value. Eurostat is not, I haven't seen any decision from Eurostat deciding which kind of payments are going to fulfill this criteria. But I'm worried that only payments based on activity or case are going to pass this criteria, because only member states with DRGs have their hospitals classified outside of the general government sector. So Germany, Belgium, the Netherlands. So why do we have to pay only based on activity? If we know that the US experience, activity, when you pay just based on activity, increases the volume, but not just in the US. In France, in 2002, the DRG started, and we followed the sequence after the tarification à l'activité. In France, the volume has been increasing for like 10 years now. So why do we have to pay only through activity? Why a public hospital that is performing perfectly with a bundle payment or with a capitation payment has to be reclassified inside of the general government sector? Maybe it's more sustainable in the long run. So you should not, as I'm not saying that you don't have to pay with DRGs. Obviously, yes, if it's doing better for that hospital, but not to determine that one hospital is going to be less sustainable. So this is the DRGs just in Germany. France is a special case because France could fulfill the requirements during the European System of Accounts 95, but the government decided, no, I don't want to classify my hospitals outside of the general government sector because this is France, this is public sector. So it was a decision, but you can have also the decision of create these competitive hospitals working well, but public control it and public finance it. So if we look at the manual, and with this I'm going to end up, if we look at the manual, and this is the manual from 95, so it was more flexible. So they're not going to allow you to consider sales payments through a global budget. So we will see what's going to happen because we don't have decisions. So the final conclusions. We should align the European System of Accounts requirement with other goals. Because, you know, they know that states are going to try to achieve these goals. They're going to try to fulfill these requirements in order to reduce the deficit and to reduce the debt, because member states are suffering from the budgetary discipline. So at least align the goals to, okay, achieve this goal, but at the same time, better quality care, better efficiency, and reduce cost. And then in terms of the market, you should allow in the monopsony situation because it's going to reduce costs. And then allowing competition is correct competition, but if it's going to bring innovation like in the US, because maybe we're going to have the worst of scenario, like competition but not innovation. So just in the areas that is going to bring competition, better quality care, or it's going to reduce the cost. And allow different payments to, in general, you don't have to restrict just to DRGs, or you don't have to restrict to fee-for-service, because in general, you have to determine the system of this market situation depending on assessing resource, not assessing activity. And then, because otherwise we can create again another PPP experience, like, okay, it's going to be outside of the general government sector, but in the meantime, in the long run, it's going to be really unsustainable. So, and we had to remember the initial goal, because all of this is to create solid public finances. Okay, thank you.
So there's, Esther, I think, is looking for feedback on her work, because if this is work you're hoping to continue when you return back to your institution.
Yes, obviously. I just published an article in Spanish journal, but I'm going to publish this in the European Law Journal, which is...
Folks have questions. I have a question. Maybe I can just get started. I wanted to just ask you a bit about the what do you think is the right mix? I'm sort of fascinated by the gray zone. And I mean, sort of what's the right mix in terms of sort of the private, the gray zone, and sort of government or public? Like, what do you feel like is the right way to sort of think about that in terms of shifting to all government, reducing that gray zone? Is there an ideal sort of breakdown of sort of how we should sort of demarcate those areas, or?
I guess you should have gray zone, obviously, not just reducing constantly the gray zone, but the gray zone should be determined in terms of results, because this is a case-by-case analysis. So you can analyze each hospital. How is the hospital performing? So what you have to do it with activity. So this hospital, if the hospital or the PPP is doing fine in terms of finance performing, it can be in the gray zone. So because this is so concrete and it's so hard to determine, if you're going to take the effort to analyze each operation, then do it in terms of result. Don't do it in the general terms, like, okay, so keep that gray zone with entities or with operations that you consider that are performing correctly. And if they don't perform correctly and the government is covering the cost, then reclassify them. But otherwise, allow them to be there, to be in this market situation and operate correctly. Because otherwise, we know the final situation. If you have the 60% and the 3% and the wider scope, there is only one option, that pure private. Is then or public or pure private. And you know how to do it to be pure private, because they give you like the path to go to just pure private.
understand correctly that the data is 7 years old? You sharing something about?
No, the data is just not the normal data that I use. No, just like the survey, the classification of the hospitals in Europe, you don't have access to that survey. It has to be through your statistical national authorities, because Eurostat is not going to give you that information. So you're going to have access to the advices. So the data is okay. The last time that I saw all the classification is 2009. But I have seen the advices through all these years, so I can follow the cases. So I know that the last time Eurostat with the dialogue with Germany asked Germany directly, why your hospitals are outside of the general government sector? And Germany is like, we have a market situation. We're not going to reclassify them. So they're going to have a discussion there. But for instance, Germany is classifying all the PPPs inside of the general government sector. So there is no discussion there, because they prefer to classify all the PPPs inside and then all the hospitals outside. But we're going to see how it's going to be, I guess, the fight between Germany and the European Commission. Because, okay, Germany can do it, but then Austria was doing it, and now all of the Austrian hospitals have been reclassified. Austria didn't have that power.
But you said that France, though,
The French,
refused to do it.
The French, they refused to do it by themselves. But nobody knows. If you have like the whole structure bill, you can just take out one hospital. You don't have to take out the whole system. And you can have, because it's a case-by-case analysis, you can have one hospital outside, because it's competing with the private hospitals, the general hospitals, and some hospitals inside, like the university hospital, the more complex hospitals inside, and some of the other public hospitals outside. So it can be a mix too. This is a good option too. Of course, there are some hospitals that they had to be inside, and other hospitals can be outside.
Public financing of hospitals is fascinating. And so the other part I'm sort of wondering is how does these different systems affect, what does the research show about the impacts on quality of care? And really, that to me, like that's what I'm sort of wondering about, particularly with the reclassification, and have there been any longitudinal studies looking to see how care has been impacted? Because
the last reclassification, the Austrian hospitals have been reclassified like 6 months ago.
Okay.
How are they going to perform it? But Hospital de Mar in Barcelona was classified outside of the general government sector. All this research started because of that, because the CEOs from Hospital de Mar was like, they knew that in Germany they were classified outside. So they asked us, like, as a researchers, to research about the classification. So they had all their concerns was like, all the concern was about, I want to be flexible. I want to pay the salary, the double salary during Christmas to my employees, because we're performing perfectly, but I cannot do it now, because I'm a public administration, I have the constraints, like the general constraints. So they were upset about that, about losing flexibility. If you are inside of the general government, maybe you're gonna be less market producer, and then, okay, this is deficit, this is that, we had to cut.
For Esther, or comments for her? Well, thank you very much for this talk.
Thank you for the interview.